Hey, what's up YouTube? What is going on? Just wanted to make a quick video and I wanted to talk about the impact that anti-inflammatory drugs and painkillers may have when it comes to hiding pain and actually possibly making things worse, specifically from a movement perspective, but also for someone that may be dealing with a nagging injury and maybe they're wondering why they're still in that position where they're dealing with an injury. So the reason why people may take anti-inflammatory drugs or painkillers is to get pain relief, for no simpler terms. But the problem is if we were to take an athlete, let's say maybe a hockey athlete or maybe a baseball athlete, and maybe they have some existing low back problems and they have trouble maybe shooting a puck or throwing a baseball, and their back maybe flares up after so many pitches or maybe after so many shots in hockey, and they may take maybe an anti-inflammatory drug or painkiller to take away that pain so they can perform their activity without having to deal with that pain or having it bother them. So while this is a simple and quick solution to the issue, in the long run, this is exactly how things may get worse or get progressively worse. And what I mean is that when one takes painkillers or anti-inflammatory drugs, is that they're just covering up the pain, and it's not actually addressing the issue at hand, which could be poor movement patterns or maybe just the injury itself that is present is not cleaning things up per se. And so really, when it comes to a coaching perspective, this is where things are very important, specifically for someone like myself, to identify what maybe movement flaws may be occurring with regards to the way maybe they're throwing or with regards to how they're shooting. Maybe they're lacking some rotary stability. Maybe they're lacking some lateral stability, maybe some hip stability when they shoot or when they throw a baseball. And as a result of that, that could be maybe triggering their pain. And so maybe developing some more stability in those areas could take away their pain and help clean up some of their poor movement patterns that may exist. And the thing is, when we keep relying on these painkillers or anti-inflammatory drugs, we're essentially just hiding those poor movement patterns and really just continuing to go into those poor movement positions or poor movement patterns and really just making things worse in the long run. And so, like I just mentioned previously, as a coach, I'm looking for these little movement patterns that exist, and I want to identify what I think is poor or where improvement needs to be made, and then I could address things from an exercise program standpoint to help take that individual out of pain and get them back to a high performance level without having to rely on pain medications or anti-inflammatory drugs. And I'm not saying there's no benefit in painkillers or anti-inflammatory drugs. There's obviously a time and place for them, but if you're going to progressively use them to cover up poor movement patterns and really to just take away the pain, then in the long run, you're really kind of setting yourself up for some significant problems, and you may only be making things worse in those moments. And so that's just something that I wanted to kind of mention in this video, and just something to think about as well. And it's why some people may not ever get better with regards to maybe an injury. Now, I specifically like to focus on the low back, but this could be a shoulder issue, a knee issue, maybe an ankle issue. A lot of people will just take painkillers or anti-inflammatory drugs to take away the pain. But the problem is when they do that, they then will go into positions that they probably shouldn't be going into without them even really knowing it. And the next thing you know, they're making things worse without knowing it, and they wonder why they end up in a worse position, or maybe they're worse the next day and they're in significant pain the next day. So if you can look to that, and it's just something to think about and be cautious with. And the one thing to consider is that we have to look at how one moves and what their posture is like and where we can improve and how we can maybe manage things or improve things for that matter. So if there's one thing to kind of take away from this video, is to just be cautious with painkillers and anti-inflammatory drugs, specifically for someone that's dealing with an injury, and look to maybe different movement flaws or posture flaws that you may have if you have pain with a certain activity. So an example with someone with low back issues, sitting is a common position that many people have problems with. So once they can eliminate sitting, or at least limit it to a significant extent, then typically many people may see improvements with regards to their symptoms and to their situation. So just a thought, just wanted to share that with you guys. If you have any questions, comments, anything you would like to hear or anything you'd like me to address, please leave a comment below. And with that being said, guys, I wish you guys all the best and a successful and productive day, and take care.